The NCLEX question of the day states, a client with diabetes is hospitalized for debridement of a non-healing foot ulcer. Following the procedure, the nurse notes that the client has become confused and combative. The family expresses concern with the behavioral changes and requests that the client be restrained in bed. What is the nurse's priority action? So when I first read this question, I highlight what stands out. What stands out to me is that this patient has diabetes, they just had a procedure done, and now the nurse has recognized that the client is confused and combative. So what will be the answer for this? What do you need to do with this patient? What should immediately come to your mind is that this patient needs to be assessed. Something is wrong with this patient and we need to find out why. So when we look at these answers here, the answers state either notify the primary healthcare provider, 2. Apply a vest restraint as requested by the family, 3. Move the client to a room near the nurse's desk, or 4. Obtain a fingerstick blood glucose level. Now, number one is definitely not the answer. If you call that healthcare provider and you say, "Oh, my client is confused and combative," he's gonna ask you if you've assessed that patient. So that is definitely, we know that's not right. Number 2, apply a vest restraint as requested by the family. No, we need to find out what is wrong with this patient. We don't just restrain our patients without assessing them, without finding out what is wrong. Move the client to a room near the nurse's desk. Is that going to solve the problem? We don't even know what's wrong. We have to assess. So the correct answer is obtain a fingerstick blood glucose level. And I hope that you guys can understand that this is the correct answer because it deals with assessing the patient and finding out what has made him confused and combative. A clue in the question was that this client has diabetes and was hospitalized and had just had a procedure done. Being able to obtain his fingerstick blood glucose level will help you determine if this is what was causing the confusion and the combative behavior. So tune in next time for other NCLEX question of the day. Remember to subscribe, share, subscribe, and like, and turn on that notification